All right, welcome back. So this week we're taking a look at the 90-90 hip lift exercise. With this exercise, why do we want to do this exercise? If we're experiencing pain, discomfort, stiffness, soreness from an overextended lower back. So we are dealing with an anterior pelvic tilt where the lower back is extended and compressed and tight. The hip, you may be experiencing significant hip tightness. You notice that you get a lot of relief when you're sitting down, but when you stand up, there's tightness in the hips. Maybe you're even experiencing some low back sacroiliac joint pain, some hip pain. These are all reasons why we want to take a look at this exercise. The setup here, there's quite a lot going on here, so I'm going to walk you through that now. You can see the hips are at 90 degrees, the knees are at 90 degrees. I've got my feet flat on the wall. That is very important. So you want to make sure that whether or not you're in shoes or you're barefoot, you want to make sure that you can really feel that wall when you set this up. Also, I've got a 5-inch exercise ball between the knees. That exercise ball between the knees engages the inner thigh muscles, the adductor muscles, which also helps us with lumbopelvic control. Now that we're in place, this exercise is really, really good at relieving lower back tension. So what you'll notice here initially, I'm going to go ahead and back this up. You can see that I squeeze that ball. It's about a 3 or a 4 out of 10 effort right there. 3 or 4 out of 10 effort right there. So we're not crushing this ball, we're just squeezing it gently. Once I squeeze that ball gently, I'm now going to pull down on the wall with the feet. Remember, I am not pushing on the wall. I'm not pushing away from the wall so that I can bridge my hips off the floor. I'm pulling down on the wall with my feet, engaging the hamstrings so that I can gently lift my hips. What you should feel is you should feel your tailbone rock off of the floor, and you should actually feel your lower back press more firmly into the floor. A lot of times what I do is I give my clients, my athletes, a washcloth, a rolled up washcloth, or a very small hand towel to put under the low back so they get that tactile feedback. They can actually feel their lower back pressing the rolled up washcloth or the rolled up hand towel into the floor. Again, pull down with your hamstrings, feel the hips lift into the air. Now you're going to breathe. Inhale through the nose 4 times, exhale through the mouth. So inhale through the nose, exhale through the mouth. 4 breaths equals 1 set. You'll want to produce 4 sets of this exercise. So again, if you're having a lot of lower back tightness, stiffness, if you know that you have an anterior pelvic tilt and you're kind of walking around with that increased pressure through the lower back, through the sacroiliac joints, tightness in the front of the hips, you normally walk around and you know that you have anterior hip tightness, you lay down on your back and you can actually feel that when you lay your legs flat, you feel pressure through your lower back as soon as your legs kind of straighten out and those hips kind of straighten out. Those are all reasons why this exercise might be beneficial. Once again, if you have any questions about whether or not this exercise is right for you, please reach out to me. I'd love to talk that over with you, get you in, make sure that you get the right diagnostics, the correct diagnosis, so that you know that this exercise is right for you. Thanks again for watching. Please reach out with questions, and I look forward to seeing you again soon.